morning, Dr. Science. Good morning. My name is Dr. Jeff Duke. I'm at Pilchuck Veterinary Hospital. Who do we have here?
Tanner.
This is Tanner, huh? Well, thanks for bringing Tanner today, Addie. Are we going to have a look at him and see what we can figure out about his health?
Yeah.
Okay, well, let's go in the building and get started. Cool dog. You like him a lot? Yes. Well, I'm a veterinarian, Addie, and I've been a veterinarian for almost 30 years, and I cannot imagine a profession that uses a bigger variety of science than a veterinarian does. Because if you think about what veterinary medicine does, I enjoy working with dogs like Tanner a lot, and especially dogs and cats. But there's veterinarians that work on marine wildlife. There's veterinarians that work on reptiles and birds. There's veterinarians that work in zoos. There's veterinarians that work in research. There's veterinarians that work on cows and horses and camels. I mean, just think of every animal in the universe, pick one. And veterinarians have training or can pursue training to look at. So just the amount of animal patients that we can look at is extremely diverse. Lots of them. All right, well, one of the things we do, we use all kinds of different kinds of science when we're even just doing a physical examination. When Tanner comes in and I want to see how healthy he is, does Tanner do a good job of talking to me and tell me where it hurts? No, he doesn't, does he? I'm going to have to do a good physical exam, and I'm going to have to look at lots of different things in order to see that. So as a veterinarian, I become an ophthalmologist that looks at the eyes. And this is called, not surprising, an ophthalmoscope. So it's a scope that looks at eyes, right? And so I use a bright light and I look in the eyes and I see all kinds of interesting anatomy back there. There's nerves and there's blood vessels and there's what's called a tapetum that reflects the light back so that Tanner can see in the dark. And so I can look in here and make sure everything is healthy, because he can't tell me if he can't see very well, can he? No, he can't. Well, not only do I get to be an ophthalmologist, but I get to be an otolaryngologist. That's a hard one to say. I don't even think I said it very well. Well, what I get to do is I get to look in ears, and dogs oftentimes have ear concerns in there. And so this is an oto, which means ear, scope, which means something I can look with. And I can look down inside the ear canal, clear down to his eardrum. Tanner has a clean ear. It looks good down there. Also, a veterinarian gets to be a dentist. Had you thought about that? I get to look at Tanner's mouth, and I get to look at his teeth and his oral health. And in fact, it looks like Tanner hasn't been brushing his teeth very much. Do you brush Tanner's teeth? No, we don't, do you? Well, he's accumulated plaque and tartar on his teeth, which is an accumulation of both minerals and bacteria. So now I'm a microbiologist, aren't I? Because there's bacteria involved in here. And that's where the odor in his mouth actually comes from. He also has a little bit of gum swelling right there. Do you see that little spot right there? So now I need to be concerned if that's a cancer or not. So now I'm an oncologist. I just can't decide who I am, can I, Addie? Well, actually, that looks like it's something that's fairly benign or not very serious, but sometimes it can be. And so a lot of times we have to use a variety of technology to figure things like that out. So we do use x-rays, and x-ray radiation is something we can use to penetrate the tissues, and then we have a plate on the other side, and we capture the image digitally. We can look at this radiograph, it's called, because it's the actual picture taken with the energy that is an x-ray that goes to a plate receptor and forms this image. So this is the image, and we also talked about the anatomy. So the kitty cat's head is up here in this picture. This radiograph is showing us this is the area of the lungs. This is the actual heart itself. This is the trachea or the windpipe, and so you know the spine comes back here. This is the liver, the stomach, and intestines. Kidneys are up here, and then the pelvis is back here. So we can see a lot of anatomy with an x-ray, can't we? We can see a lot of different things. And this is the ultrasound machine, and this is the probe. It emits sound energy, and then the sound energy that's reflected, it also has receptors to detect them coming back. And so as I move them around Tanner's abdomen, I can see different kinds of tissues, and I can check and look for everything being normal size and normal shape and any kind of problems that might come into play. So this works really well in the abdomen because the sound waves penetrate and bounce back. Doesn't work as well in the chest because the chest has lungs full of air and sound waves just kind of disappear in the air, so we can't really see a lot in the chest with this. Do you have any questions for me?
No.
All right, well, thank you for coming today. Are you ready to go, Tanner? You've had a busy day, haven't you? Here we go.